Hello and welcome to the program. I'm Jeremy Fernandez. Victoria has recorded the highest number of daily cases in Australia since the pandemic began. There were 1,838 cases in the last 24 hours and it's expected there's worse to come. The Victorian government has announced additional mask mandates when schools return. Children in years 3 and above will be required to wear them indoors.
So we really want to have these measures in place early on to keep kids in school and to make sure that they're safe in the school environment, as safe as possible. In many states in America, school mask mandates have been put in place and they've helped to reduce transmission.
In a moment, we'll cross to the US to see how students and teachers there have coped since schools were reopened. But back home, Victoria isn't the only state to have announced changes to the return to school plan this week. The new New South Wales Premier has brought forward face-to-face learning. All year levels will now be back in the classroom by October the 18th, scrapping the previous plan, which saw a more staggered return. The changes were announced after the state reached that 70% double dose milestone. But what does that actually mean? Casey Briggs breaks it down for us. Casey.
Hi Jeremy. Well, when the state's restrictions start to lift on Monday, we should hopefully, with any luck, be looking at a case curve in New South Wales with a 7-day average of cases in the 500s. And the vaccination levels across the state, well, they'll be heading up toward the mid-70 double dose. That's, of course, of the 16 plus population. But who isn't vaccinated? Let's talk about that as well. And if we look at the New South Wales total population, not just including kids, we're at about 72% of the population with a first dose, 57% double dose. So that's 43% of people for whom these that will be unvaccinated come Monday. And that group of people, it sort of splits into 3 roughly equally sized groups. About a third of the unvaccinated people are kids under 12, people who there isn't a vaccine available for them at this point. About another third are people who will still be in lockdown come Monday for a little bit longer because they've had their first dose but not yet their second dose. And the final third of the unvaccinated people, they're people who are eligible but are yet to get that jab. And so what we'll see as the restrictions ease is that, most people and a growing number of people will become fully vaccinated. But there are parts of the state where the restrictions are actually going to be imposed on Monday. In regional New South Wales, for example, in the Byron Shire, we're looking at an area that's only had a handful of cases and most of the population's unvaccinated. So all of those people, the majority of eligible people, will actually have new restrictions on them, a pseudo-lockdown of sorts. There won't be a formal stay-at-home order in place, but some of the things that they are freely able to do right now, they won't be able to do without their vaccination certificate. So, of course, we'll all be watching, the entire country will be watching what happens in New South Wales with case numbers in the coming weeks, and not least of all Victoria, where we're watching, waiting, desperately hoping to see a peak in these case numbers, 1,800 more of them on Friday, and we're yet to see these numbers coming down. And the runway of time that Victoria now has to really drive these numbers downwards to get them as low as possible before getting to phase B, 70%, when the restrictions will ease there as well, probably at the end of the month. Well, that runway is running out rapidly. And if you were looking to ease restrictions at this point, well, the Doherty Institute modelling might give you pause for thought. If you end up looking at easing restrictions, Jeremy, when you're still recording thousands of cases a day.
Casey, thank you. Let's bring in Alice Leung now. She's a teacher in Sydney's Inner West and she's also a representative of the New South Wales Teachers Federation. Alice Leung, thanks for your time on the program. There's been a lot of time to consider what the return to school will look like for everyone. So why is there so much reticence mixed in with all the excitement?
All teachers, like parents, would want nothing more but to return to face-to-face learning. I know, as a parent myself and a teacher, I am over supporting home learning and also doing remote teaching myself. But the original plan that was originally proposed, which has now been changed twice now in the space of a week, means that it magnifies the challenges for schools to make the place as safe as possible for our teachers, for our school staff, and for our students as well. So schools aren't like pubs. Schools aren't like hairdressing salons. Physical distancing is almost impossible in a school, and not all teachers have had the opportunity to have their two vaccines yet for COVID. So bringing the return to school forward again, the second time, a second change again in the space of a week, just means that it makes things a lot more challenging for schools. And the latest change is not as staggered as the original proposal. We now only have like kindergarten, year 1 and year 12 coming back on the 18th, and then everyone else coming back the week after. So originally it was meant to be a 3-tiered staged return that would have allowed schools to really test out and adjust their processes in terms of cohorting, separating different year groups, make sure there's minimum mingling between the year groups in case there is a positive case that will reduce the number of close contacts. All those sort of processes, we now have less time to do that. So I think it's like teachers, principals, and school staff are now just really scrambling to make sure that we just need to do what we can in the now shorter space of time that we've been given.
So it'll be up to teachers, won't it, to enforce some of these basic mitigation measures. How do you think they're going to go with that?
So, some of the mitigation measures, I know in a high school setting, all the students will be required to wear masks indoors and recommended for them outdoors as well. So all of those things teachers will have to support. It's yet like another challenge on top of the other things that teachers have to deal with. But it's not something that it's like a great concern to the colleagues I have spoken to. We've had a lot of, I know with my school, students have been quite good with masks even before it became mandatory. So I think it's just to support those students, to remind them how to wear them properly and to just remind them to wear them when they're indoors.
Alice Leung, so good to have your perspective on the program. Thanks for joining us.
Thank you.
It's been a difficult couple of years for hundreds of thousands of students who found themselves learning remotely for months on end. It's been particularly challenging for Year 12 students gearing up for exams. Hannah Bentley is in her final year at Picnic Point High School in Sydney's southwest. Hannah, what's been the most difficult part of trying to complete Year 12 with all this disruption going on?
I think definitely like the uncertainty surrounding like the HSC and everything. It was moved a couple of times and there was lots of rumors going around that it wouldn't go ahead or it'd be optional, and like no one knew what was going on. So I think it's hard to really, as I said, keep the motivation and like keep yourself, I have to get this done. Why am I doing this? When it's like we weren't actually sure if there was a reason like why we were doing all this studying when we were unsure if the HSC would go ahead.
Your school is also in one of the LGAs of concern, so I suppose you've had very little contact with anyone.
No, not at all. Yeah, so my school's in the Canterbury-Bankstown area. So even when I know like last month or something, there was a week where we were told that other schools were going to be allowed to go back, but not our school because we're in one of the LGAs of concern. So that was really hard knowing that like we were, again, missing out, and how strict all the conditions have been, specifically for our school, it's been really difficult to deal with that.
Now that schools are reopening, tell me, how are you feeling about it?
Really excited. We're just like super, super keen to get back. That's all anyone's been talking about for the past 4 months for us is like, can't wait to get back to face-to-face learning. So we're really excited. Obviously, it's not going to be normal because our classroom learning's over. So I think we're going back for seminars. But, we'll take what we can get. We're just really, really keen to go back to school and have some sense of normality leading up to the HSC.
And how are you feeling about the prospect of doing your Year 12 exams, given the scale of this disruption?
It's hard when that's all that's been drilled into our head, the past how many ever years I've been at school, that you do your trials and then you do your HSC. It's at this time, nothing's ever changed. And then it's hard for us when it's been so out of this world, nothing's been normal. It's all changed. It's hard to get yourself in the right headspace to, think, okay, we are actually doing the HSC when it doesn't feel like that's what's happening at all. So that's kind of scary.
Hannah Bentley, thank you for your time and good luck with everything. Children as young as 5 in the US could start getting vaccinated within weeks. Pfizer has asked federal regulators there to authorise emergency use of their vaccine for children aged between 5 and 11 years old. Cases surged in the US when schools returned last month. What does it tell us about schooling while COVID circulates? Well, Elizabeth Stewart is a biostatistician specialising in the analysis of what happens when certain public health measures and education campaigns are carried out or removed. Professor Stewart, thanks so much for joining us. In the United States, can you pinpoint the most important safety measures that have worked in schools?
Yeah, schools in the United States have been open this academic year for about a month or two, depending on the area of the country. And the schools that are reopening safely are really following the Centers for Disease Control and Prevention guidelines around what's called a layered prevention strategy. And I think of 5 main pieces, 5 main layers to that. Vaccination, so vaccinating as many people in the building as possible. Ventilation, improving the ventilation. Masking, having people consistently wear high quality masks. Testing, using COVID testing strategically. And then finally, avoiding sort of large indoor gatherings.
Are some of those measures more effective than others?
Anyone over age 12 who's currently eligible for the vaccine, getting them vaccinated should be priority number 1. The rest, it really is, again, sort of this layered approach. At least in the United States, I would say the most controversy has been around masking and mask mandates. And we've seen a lot of variability across different schools and school districts and states in terms of whether they do have mask mandates. But there's a lot of evidence showing that the places without consistent mask wearing and mask mandates do have higher transmission in schools and higher case rate.
How have the risks affected the rate of absenteeism in schools?
Such a great question. And this is a real tension because we all know that being in school is really important for kids. They get academic, improvement. Many of them get their meals at school. There's so many reasons that we want to keep kids in school. And then there's this tension. And so especially in the US, there have been schools that have had to shut down for a week or two if they've had a surge in cases. The other sort of area of a lot of innovation right now is around quarantines. And so traditionally, if someone was a close contact, had an exposure, they would automatically have to have about a 7 to 10 day or even 2-week quarantine and stay home. Many school districts and states are moving to what's known as a test to stay approach, where as long as they have a daily negative rapid antigen test, they can go back to school. So it's a way to sort of use these tests to balance keeping kids in school, but while minimizing the risk of transmission.
How long will it be before 5 to 11-year-olds are allowed to get vaccinated?
Yeah, it's an exciting time. I actually have a 10-year-old, and so we are waiting very, anxiously for him to be able to get vaccinated. Today was an exciting day because Pfizer actually submitted their official paperwork to have the emergency use authorization expanded to the 5 to 12-year-olds, 5 to 11-year-olds. And there's a meeting by the Food and Drug Administration at the end of October. So there's a hope that that EUA will get expanded maybe by Halloween for us, and that these kids will be able to get vaccinated. I want to stress too that I hope that schools and school districts are really thinking now about how they're going to facilitate vaccination once it's available so that we can get as many kids vaccinated as quickly as possible.
There's a concurrent push to improve ventilation in buildings such as schools. How necessary is that and how far should it go? Are you concerned that it would become unfeasible at a large scale?
Yeah, so many school districts are grappling with this and figuring out sort of what they can do. Clearly, yeah, it's hard. A lot of places don't have the funds to invest in a huge new HVAC system. I think it is important, though, to do what they can. So look into the system, make sure it is operating at its best capacity. There are also some relatively low cost either units, sort of additional in-room units, or even things people can make. If you do a little Google search for YouTube, you can put together air filters in a very cost-effective way, and it's going to help. Or keeping windows open. Again, just sort of trying to think creatively about avoiding these small closed spaces that don't really have ventilation. So even if you can't go sort of all the way to a really fancy, amazingly functioning system, there are still steps that everyone can take.
Professor Elizabeth Stewart, thanks so much for joining us.
My pleasure. Thank you for having me.
And that's the show for this week. Thanks for your company. Goodbye.